On behalf of the National Eczema Association, I'd like to welcome you to our webinar presentation, 5 Common Insurance and Access Questions Answered. Here's your host, Nora Eigenbrod.
This webinar is sponsored in part by an educational grant from Sanofi Regeneron. So this webinar will be hosted by Michele Guadalupe. Michele is the Director of Advocacy and Access for the National Eczema Association, bringing over 20 years of experience in healthcare advocacy and access. We are delighted to welcome Michele to lead us in this webinar. I'll hand it over to you, Michele.
Great. Thank you so much, Nora, and hi, everyone. Today's webinar, we are going to be covering some common insurance and access questions. We're also going to be providing you with resources for navigating your access issues. And we, of course, want to make sure that we have some time if you have any questions that we can help answer. So here's just a little bit of an overview of the questions that we're going to go through in a little bit more detail. When can I make changes to my health insurance plan or enroll in a new plan? What eczema expenses are covered under insurance? Are over-the-counter moisturizers covered by my insurance? What prior authorization steps are required before my medication will be approved? And what can I do if my prescription is denied? So let's tackle that first question. When can I make changes to my health insurance plan or enroll in a new plan? So you can do this during open enrollment, which is typically in late fall or early winter. Open enrollment is that set time period each year when you can enroll in a new healthcare plan or make changes to existing coverage. We're actually in open enrollment currently. Medicare open enrollment started on October 15th and it ends on December 7th. This is so that you can have coverage to begin on January 1st. You can visit medicare.gov. We also have an insurance webinar on Medicare that you can reference as well. Medicaid, if you're eligible, you can enroll anytime by visiting medicaid.gov. The Affordable Care Act, enrollment just started on November 1st, and the deadline to enroll for January 1st coverage is December 15th. You can go to healthcare.gov to find out more information and figure out how you can get that coverage. Many of us have employer-sponsored health insurance. So what you can do there is to check with your employer and the HR department. That typically happens around this time of year, but they can share with you their specific open enrollment dates. So when can I change my health insurance plan, or if there's ever a special enrollment period? So this can be if you have a child, if you are adopting a child, maybe you just got married, you either started a new job, maybe you don't currently have a job. These are all considered special enrollment periods. So that is outside of this typical fall open enrollment time. During open enrollment, be sure to reference our checklist for selecting an eczema-friendly insurance plan. Wanted to make sure you also had this information. So the first thing, we just already talked about open enrollment. We also suggest that you estimate how often you go to a doctor in a year. So look at your previous year. How many times a month are you visiting a provider? How many different providers are you visiting? Get a baseline for how much medical care you need regularly over the course of a year. This will help you know what you need your insurance coverage to actually cover for your personal needs. Estimate your current prescription needs and costs. How many prescriptions do you have and how often do you need to fill them? Get a sense for how much you spend on prescriptions over the course of the year. You also need to look at that cost for deductibles, copays, coinsurance, and other expenses. How much is the deductible? This is also known as the amount you have to pay before the health plan pays. What are the copays, which are those fixed amounts you will pay for certain services? Or do you pay coinsurance, that percentage of cost for certain services? Using your personal estimates for prescription costs and doctor visits, you can get a better idea of how much each plan will cost you. Also, review the list of available healthcare providers. You want to make sure that your current doctors are covered under the plan. Or if there's a new provider you want to visit, you can go and look and see if those providers are covered. You can find this information on your selected insurer's website. Or if you're already insured, you can call the phone number on your insurance card to confirm. You may also call your doctor's office or check their website to see if they accept that particular plan. You'll want to ensure that your current prescriptions are covered under this as well. If you think that you might be changing prescriptions in the future, if you and your healthcare provider have had conversations about, maybe he or she wants you to have a different course of treatment, those are all things that you should put together and determine just to ensure that whichever healthcare plan you have, that would be covered. If you know that you might have additional expenses or you might have different diagnostic tests, those are all really good to look at just to ensure that they are covered under your plan. You should really consider that plan based on those anticipated needs. You'll want to have those conversations with your healthcare provider to have a better understanding of your healthcare needs for that calendar year. It's also important to take advantage of tax-free dollars for your health expenses. This can be done through a flexible spending account or an FSA, or a health savings account, or an HSA. Each of these options let you set aside money on a pre-tax basis to pay for qualified medical expenses, such as deductibles, co-payments, co-insurance, and prescriptions. You could estimate the amount of money that you want to contribute with each of these plans. Make sure that you start early and compare your plan options. All right, I know that was a lot. But it's just really important when you're in open enrollment, when you're thinking about your plan and what your needs are for the year. We just want to ensure that you had that easy checklist so that you can take that with you when you're wanting to cover this plan. So what eczema expenses are covered under insurance? This has also been a very common question that we've received. So in thinking about what is typically covered, your prescription medications for eczema, many medical services, such as doctor visits with dermatologists and allergists and allergy testing, phototherapy, emergency care, such as hospitalizations or emergency room visits related to severe eczema. And if you have lab work, be sure to work with your doctor to send to an in-network lab. Really, with all of these, you want to ensure that you are receiving in-network benefits. I know it can be a lot, but every time, if you're looking at doing this, you'll want to make sure that you have those conversations both with your health insurance plan as well as your healthcare provider. You may find that you'll need to do prior authorization in order to have some of these covered, and we'll cover that in a future slide. All right, another question that we've received multiple times is, are over-the-counter moisturizers covered by my insurance? We have noted, we have seen that some prescription barrier repair creams can be covered, but that will need to be confirmed with your insurance. You can call the phone number on your insurance card to confirm. I had mentioned FSA or HSA before. There are, some over-the-counter moisturizers that can be reimbursed with additional documentation by your doctor. When you are looking at a variety of over-the-counter moisturizers, we do have the Seal of Acceptance program through the National Eczema Association. Those go through, they have rigorous testing to ensure that the ingredients are really good for, people with eczema. So that could help you in the process. But as I mentioned before, you really just need to have conversations with both your healthcare provider as well as your insurance, because at sometimes those repair creams can be covered. Another question that came from our community: what prior authorization steps are required before my medication will be approved? So just as a refresher for those that may not know, prior authorization, this is when it requires your doctor's office to submit a form detailing your medical history, current health issues, medications, and other relevant clinical information. This needs to be reviewed by your insurer before that submitting of the prescription. So when they look at that request, they will do one of the following. They may just approve the treatment, or they may deny, or they may request additional information. So it's important that you track the status of your prior authorization request and work with your provider in a timely manner if they need more information from you. Once an approval is made, you can coordinate your pharmacy to fill the prescription. If a denial is made, you can file an appeal. Please note that insurers may request prior authorization on a regular basis, so maintain all documentation. So sometimes prior authorization, it might be every year you have to complete this information with your doctor. They may ask for more frequent. So again, it's always good to keep a record and have those conversations with your doctor's office. Another issue that has come up for many of us is step therapy. And this is a form of prior authorization, and it impacts many eczema patients. You may not have known it was called step therapy, but this is when an insurer will require a patient to try and fail another drug before the insurer will cover the medication originally prescribed by the doctor. Many of us have gone through step therapy at a variety of times. It could be right as soon as you're diagnosed. Your doctor may know that step therapy is going to happen. So they will go through a number of different treatments, see what works for you, what can be documented. Sometimes step therapy can be a hindrance for patients, especially when you have been stable on a medication. You may change your insurance based on a new job or another kind of life change. So just know that NIA is working with many people to reform step therapy so that all of us can have that timely access to our medication. So what are the steps that are required before my medication will be approved? Talked a little bit about this, but did just want to reiterate that your doctor does need to submit a form to your insurer for review. They then look at that request, either they approve it right away, maybe they deny, or they request more information. Hopefully they will get that approval, and then you can coordinate with the pharmacy and be able to get your treatment right away with minimal delay. But if that denial is made, you can file an appeal. So really wanted to kind of hone in a little bit more on what you can do if your prescription is denied. I know we have probably all been there. It can be a little bit frustrating. But we did want to share with you some tips and, really want to make sure that you can get those prescriptions in a timely manner. So if it is denied, you do have that right to appeal your claim. You can file an internal appeal directly with your insurance company. If that is ultimately denied, you can also do an external appeal to your state's insurance regulatory agency or the Department of Health and Human Services at the federal level. So I wanted to kind of go through step by step on what you can do if your prescription is denied. Really just wanting to go right from the very start to the very end. If you do have a prescription that is denied, you will get a denial letter. You'll really want to, review that letter in great detail. Want to ensure that you see if your insurance company has provided a reason for the denial, and they also might have any deadlines for you in appealing that decision. So that deadline to appeal is typically included in your denial letter. You really want to pay close attention to that. You personally can start gathering your supporting documents, so your policy details, your medical records, and also definitely work with your healthcare provider and getting a letter from them on why you need the prescription. Sometimes patients will write the appeal letter. Other times you can also work with your eczema healthcare provider for them to write it. They have, a lot of experience in writing these letters, really advocating for their patients. So they are a great resource. But within that appeal letter, you'll want to clearly state your case. You want to reference that denial letter and explain why your claim should be approved. Just ensure that you include all of your supporting documents. Make a copy for your records. That's really important. You'll want to ensure that your appeal letter gets sent to the insurer and all of those different supporting documents. You can really look and see what is preferred by your insurer. This could be mail, email, or fax, and want to ensure that you get that tracking so you can confirm that they've received it. Make sure to track the progress to confirm that they received it. If you've written that it's needs to be an expedited review, this is especially important if it is more of a life-altering issue that might happen. If you aren't able to get your prescription, you might be able to have it expedited, and you could work with your healthcare provider on that. And then you'll want to follow up with any additional requests from the insurance company. We really notice sometimes it's little things, but those little things that maybe they didn't get one piece of information, and it can really delay you getting this prescription approved. So you always want to ensure that you go through these steps, that you file that internal appeal first. If it comes back and you are still being denied, you can go that extra step and get the external appeal. All right, I know that was quite a bit of information, just really scratching the surface on, what happens during open enrollment, what happens, what kind of prescriptions over the counter or any of those, if they're covered. Also going into some of the common issues facing, patients, those prior authorization issues, being able to appeal a denial. I wanted to make sure that you all are aware of resources that we have for navigating your access issues. So if you go to nationaleczema.org/insurance, you're going to see quite a bit of information. We have, podcasts on open enrollment. We have a number of different resources, including an insurance glossary. You might be like, oh my gosh, Michelle, what is the difference between a co-insurance and a copay and a deductible? All of those terms are, defined in that glossary. And we really just want to make sure that you have this information at your fingertips. So make sure you visit that, and you can always, hopefully those will help answer more and more of your questions. And with that, I wanted to make sure we had plenty of time for questions. So I'll turn it back over to Nora.
Thank you so much for that informative presentation, Michelle. I know we've gotten a few questions submitted from our community, so happy to turn to those now. And there's still time. If you'd like to submit another question, please feel free to do so, and we will be sure to get it answered. So our first question that I see here is, my daughter has been on and off topical treatments for a decade. We applied for Dupixent for the first time this year through the dermatologist, and insurance denied it. Why? How can we get a better chance of approval in a future application? Thank you. So I know we touched on this a little bit around denials, but do you have any other tips or advice that you would give this community member?
Yes, I think kind of what I was talking about a little bit earlier is, insurance really looks to see, what has, it sounds like, she had been on the topicals. So some of it could just be, want to ensure that your patient, that your insurer has that documentation. And I would say, ensuring that you have gathered all of that relevant information, being able then to work with your provider directly and being able to resubmit. Many times the denials will happen, and we had seen in our survey data that we do of the atopic dermatitis community and our eczema community is there's a pretty significant portion of our of folks that aren't even aware that you're able to appeal that decision. So they also in subsequent had found that the majority of cases, once that appeal has been made, it ultimately does get approved. I don't know your specific case, but I would say, don't give up and make sure that you put in any additional documentation, work with the provider. Many of the provider offices will actually some of them have full-time or part-time staff. That's what they do, is they work with insurers and say, okay, what else is needed to ensure that my my patient can get this coverage.
Absolutely. Yeah, I think it's important to know that you have multiple avenues here to pursue when it comes to with your insurer, but also potentially in an external appeal as well. So, and we have plenty of resources on that as well on our insurance hub. So kind of a follow-up question from the same attendee here, which is, do they ever make exceptions to step therapy for kids, especially when they've only been on topical treatments for 10 years without other treatments? So do you see children being treated differently, I guess, in this system when it comes to things like step therapy?
Well, I think that the reason why when we talked just really briefly about step therapy reform is we know that every patient is a little different, and they might have already tried and failed, and that's not going to work for them. If the doctor can plead the case on why he or she is like these other treatments just are not appropriate for this case, those really do, those are all the types of things that the insurer needs to get that kind of documentation. So again, I have, we have seen success in the appeals. I know doctors' offices can be the biggest champions, and just want to make sure that you share that with, kind of check in with the doctor to see like what steps have they been made, and hopefully they can go from there.
Absolutely. Thank you. We have another question here from our community, which is, can I be denied insurance coverage if I have a pre-existing condition like eczema?
So the great thing is, especially with the Affordable Care Act, health insurance companies, they can't refuse to cover you or charge you more due to a pre-existing condition like eczema. A pre-existing condition is a health issue you had before the date the new health insurance, the health coverage starts. But I think that's incredible for all of us, that you no longer can be denied if you have that pre-existing condition like eczema.
Great. Thank you. Another question here is, will insurance cover mental health services? I know that at NIA, we talk a lot about the connection between the importance of mental health and eczema. So I think this is a great question.
Yeah, no, I agree. And, mental health is considered an essential health benefit under the Affordable Care Act. And so what that means is health insurance plans must cover mental health services, but the amount of coverage may vary. And so you really, that's, when we talk about, when you're looking at all of your different insurance plans, take a look and see what they have to say about mental health services. And you can also have those conversations directly with the insurance company.
Great. Additional question here says, how can I avoid unexpected out-of-network charges?
Yeah, this is a really important one. I know that as much as you can in pre-planning, we talked about, just double checking that your, providers are covered under whichever insurance plan you decide. And you can really just keep on checking the box there. Okay, my provider is covered. Now double check and call that provider and say, do you truly accept this insurance plan? When you have those conversations with the provider about, what is your course of treatment, or, am I, are you going to need lab work? Just say, we really need to make sure that whatever lab you send me to is covered. I know sometimes they might have in-house labs, and those aren't always covered. I know that, sometimes you may have to go to like another offsite place for your lab work, but it's worth it. It's real easy, especially this day and age. They may be able to electronically send the kind of the lab request, or they may physically hand you the lab form, just to ensure, because we know that insurance and all the related services can be expensive. You're paying for your insurance, you're paying that monthly premium. Let's make sure that you get the most out of it. And sometimes that is takes a little bit of homework on your end. but it's well worth it not having those unexpected charges.
Absolutely. That's always good to note. It looks like we have one final question here tonight, which is, can I change my insurance coverage in the middle of the year?
So there are times when you can change your insurance, and it's really considered that special enrollment period. So let's say, you know, you may have a child, you adopt a child, you're getting married, you're getting divorced, maybe you're starting a new job, you've lost your job. Those all trigger that special enrollment period. You know, you could certainly look at, you know, your different options. If it is a former employer, they may have what's called COBRA. COBRA can be pretty expensive, so there might be other opportunities. Could be through the Affordable Care Act, or if you have, you know, very limited income, you might be able to qualify for either Medicaid, or if you're over 65, you can look at your Medicare options.
Right. Wonderful. Well, I think that brings us to an end to the Q&A. So thank you again to Michele Guadalupe for helping us get a better understanding of health insurance today. And many thanks to all of you for joining us today. You can continue your eczema education on our website at nationaleczema.org. You can also register for an upcoming webinar or watch the recording of a previous webinar at nationaleczema.org/webinars. On behalf of the National Eczema Association, I thank you all for joining us.